Good evening, everyone. I am Dr. Sushrit Chandra, MBBS MS Surgery, and today we'll talk about patient positions in general surgery, the utter basics. So, starting off with the most common surgical position, it's the supine position where the patient lies with back flat on the operating table, and common complications include neuropathy, most commonly of the ulnar nerve, and ischemia and tissue breakdown of pressure areas like the occiput, the sacrum, and the heels. The prone position is where the patient lies flat with the chest down and the back up. It is used in surgeries of the spine and back. The complications include cardiovascular compromise, post-op vision loss, and abdominal compartment syndrome. The lateral position is when the patient lies on their side, and it is typically used in thoracic surgeries and surgeries of the retroperitoneum. Complications include brachial plexus injury, both on the dependent and the non-dependent arm, peroneal nerve injury, pulmonary compromise, and injury on the dependent eye. The Trendelenburg position is when the patient lies flat on the back with a 15 to 30 degree incline with the feet elevated above the head. It is used in abdominal and genitourinary surgeries, and complications include increase in the intracranial and intraocular pressures, atelectasis, and decreased lung compliance. The reverse Trendelenburg is when the body is placed on the supine on an incline of about 15 to 30 degrees, but with the head now being elevated. It is used in upper abdominal surgeries like lap cholecystectomies, lap CVD explorations, and head and neck surgeries. The lithotomy position is when the patient is on their back with hips flexed and legs abducted and knees flexed, and legs are secured with the leg supports. It is regularly used in urologic, colorectal, and gynecological procedures. Common complication is peroneal nerve injury. Other than that, lower limb compartment syndrome, dislocation of hip joint, venous thrombosis. The Lloyd-Davis position includes a 30-degree Trendelenburg with hips flexed at 15 degrees. It provides good exposure and fewer neuropathological side effects compared to lithotomy, as the hips are less flexed. But it can precipitate compartment syndrome in calf muscles. The jackknife position is when the patient's abdomen lies flat on the bed and the bed is scissored so that the hip is lifted and the legs and head are low. It is used in gluteal and anorectal surgeries. The disadvantage of this position is injury to femoral vessels. The kidney position is similar to the jackknife position, except the patient is on their side, and it is commonly used in donor nephrectomies, and the point of flexion should lie under the iliac crest. The roses position includes a supine position with extended head. It is done by keeping a sandbag under the supine patient's shoulder blade, and it is commonly used in surgeries of the neck, usually thyroidectomies and parathyroidectomies. Thank you.